Hi, this videos is the art of hair transplant restoration surgery, and he had a procedure done in the past, so we leave him tiny mini plugs, and the great thing is he has medium fine hair, so that's why the plugs not show not much. So our goal today is to recreate the hairline building from the front, reinforce the middle, and work our way toward the back. And we will be doing around at least 4,500 grafts. But as you know, hair transplant is not just the surgical skill that's involved. It requires a lot of the artistic and aesthetic detail to ensure very natural result. In general, creating the hairline is a meticulous detail, and on average, for Caucasian, from the mid-eyebrow to the hairline mid-hairline is around 7.5 to 8.5 centimeters. This client is actually around 7.5 centimeters. Exactly, we did the measurement. He has quite a bit of narrow face, so he arched up quite a bit. And then, as you can see, it's not only her receding hairline, but the temple has gone back, so then his temple is all straight down. The temples always have a little triangle peak in it. So what we did was we brought in the triangle peak. Now, there's quite a bit of anatomical landmark. So there's a little crevice right around the upper part of the ear right here. If you follow that, go straight across and go straight up, and that's where the angle of the temple can be located. And you follow that, and then when the hairline comes down, and the temple comes down, and when you meet that point, so you just soften that tip. And that's where the temple should be. And we brought it around a finger breadth. So from the midpoint to the temple, now is 7 to 8.5 centimeters. From the mid-eyebrow to here is 7.5 to 8 centimeters. So for this client, from the mid-eyebrow to the hairline is 7.5 centimeters. From the midpoint to the temple, actually his is 8.25, and that's just average. Not everybody gonna have the exact same. So 8.25, and again, you can turn this way. From the midpoint to the temple is 8.25. We build. You see how it curves down, forward and backward. Caucasian, the temporal angle is most acute. Asian is less acute. African American man perpendicular, and for woman is actually pointed toward the mid portion. Now, when we lower the hairline, if we don't bring the temple in, then he's gonna have a really wide forehead, and it still looks very abnormal. And so we want to make sure that we want to create the most natural hairline, that as if this client has no hair loss, what is the most highest and natural hairline that he should have? And this is where it should be. Just a little subtle change like this can really drastically change his look, but without the change is so slow that there's not much detectability. In a year time, he'll look fantastic. But now we're using a cell instead of wait for a year. I've noticed most of my clients, they have the result within less than a year. So right now in July, probably by Christmas, he's going to look completely different. Now, don't expect perfect density by then, but you can see there's quite a bit of significant changes. Once we get the shape down, I will transplant at a very precise angle. Start around 35-45 in the front, increases when you go backward, and changes when you go a different direction. For the temple hair, it's flat against the skin and pointed backward. And the temple hair is very important. The angle is important. Not only the angle, but selection of hair graft. The temple is mostly root that grows single hair, so we transplant rows and rows, root that grows single hair graft, and designed to soften the hairline and frame the face. The temple triangle is not designed for density, it's just for framing the face, and most of those hair are soft, natural hair. And so in the front too, we transplant rows and rows single hair graft in the front, followed by roots of 2 hair, 3 hair, and 4 hair in the back for bulk and volume. For the audience who want to know more of my work, just go on YouTube, type of hair transplant restoration surgery result. The 1 year post out with before and after photo by Dr. Diep. Thank you.